Hello, and a very warm welcome to all my future pharmacists. You've logged into a brand new lecture from Pharma Ed. Today, we're diving deep into a really fundamental topic, dosage forms. Now, why is this so important? Well, it's not just about passing your exams, it's about understanding the very core of how we deliver medicine. So, let's get right into it. So, let's start with a really simple question. Think about it. The active drug is the life-saving hero, right? So, why does it need a costume? Why don't we just, take the raw drug powder? Well, just imagine trying to accurately measure out a tiny dose, say a few micrograms, of a super potent drug. It's almost impossible. Or what about trying to swallow something that's incredibly bitter? Yeah, not pleasant. This is exactly why dosage forms are absolutely crucial. So, what exactly is a dosage form? Well, the textbook definition says it's the physical form of the drug. But honestly, a much better way to think about it is as the drug's personal delivery vehicle. It's the taxi that gets our hero, the active ingredient, safely and efficiently to the exact spot in your body where it needs to work. Okay, so here's our game plan for today. We'll start with the classics, the solid dosage forms. Then we'll jump into the world of liquids, which are all about speed and flexibility. After that, we'll look at semi-solid forms for targeted treatment. We'll even take a peek behind the scenes to see how these forms are designed. And of course, we'll wrap up with a quick recap and some very important exam tips. Cello, let's begin. Right, so our first stop is solid dosage forms. These are, without a doubt, the classics of the pharmacy world. I mean, think about it. They are everywhere. And the reason they're so popular is because they're incredibly stable, easy to handle, and they offer a very, very precise way to deliver a medicine. And you're already familiar with all of these. First up, we have tablets, basically just powder compressed into a solid shape. Think of your everyday Crocin or Dola 650. Then there are capsules, which hide the drug inside a neat little gelatin shell, like omeprazole. Powders are just what they sound like. The best example is the life-saving ORS powder. Lozenges, like Strepsils, are designed to dissolve slowly in the mouth. And finally, granules, which are just small clumps of powder. Think of that fizz you get from Eno. That's the granules at work. So what's the deal with solid forms? Well, the advantages are huge. They have a really long shelf life, the dosing is super accurate, and they are pretty cheap to make. But there's always a trade-off, isn't there? The main downside is that they can take a bit longer to start working. And as we all know, for some people, especially kids and elderly patients, swallowing a big tablet can be a real struggle. Okay, let's switch gears and talk about our next category, liquid forms. Now, these are all about two things, speed and flexibility. When you need a medicine to work fast, or if a patient simply can't swallow a pill, liquids are the way to go. And there's quite a variety here. You've got solutions like most cough syrups, where the drug is completely dissolved. Then you have suspensions, like Gelasil, where tiny solid particles are just floating in the liquid. That's exactly why the label says, shake well before use. Emulsions are a clever mix of two liquids that normally don't mix, like oil and water. Then you have elixirs, which are sweetened and often contain alcohol, like Dexorange. And of course, the classic thick, sugary syrups, like Benadryl. Now, the biggest win for liquids is their rapid action. The drug is already dispersed or dissolved, so it gets absorbed really quickly. It's also easy to adjust the dose. You can give 5 milliliters or 7.5 milliliters, no problem. But on the other hand, they have a shorter shelf life, and there's a real risk of bacteria or fungi growing in them. Plus, making a bitter drug taste good in a syrup, that is a huge challenge for any pharmacist. All right, everyone, just a quick pause. If you're finding this lecture helpful and you're getting some value out of it, please do me a small favor. Hit that subscribe button for the Pharma Ed channel, give this video a like, and most importantly, share it with your pharmacy classmates. Your support really helps us create more of this content for you. Okay, let's get back to it. All right, we're on to our third and final category, semi-solid forms. Now, the key word to remember here is targeted. These are all about applying the medicine directly onto the skin or mucous membranes to tackle the problem right at the source. So let's break these down. First, you have ointments, like Betnovate. They're typically greasy and oily. Then you have creams, like our beloved Borolene, which are emulsions of oil and water, so they feel a lot less greasy. Gels are usually clear and water-based, and they give that nice cooling effect. Think of Volini gel for pain. Pastes are really thick because they have a high amount of solid powder, like toothpaste. And finally, you have suppositories, which are designed to melt at body temperature to release the drug. The biggest advantage here is definitely the targeted application. When you apply a cream directly onto a rash, you keep the drug localized. This means very little of it gets into your bloodstream, which reduces systemic side effects. That's a huge plus. The downside? Well, let's be honest, they can be greasy, sticky, and just a bit messy to apply compared to just taking a pill.
So we've talked about the what, all the different types of forms. But now let's get into the how. How do scientists and pharmacists actually decide if a new drug should be a tablet, a syrup, or a gel? This, my friends, is the real science of pharmaceutics.
It really all boils down to a balancing act between three key areas. First, you have to look at the drug itself. Is it stable? Does it dissolve in water? What's its pH? Second, you have to consider the patient and their body. Where does the drug need to go? How will it be absorbed? And can the patient even use that form? And third, you have to face the manufacturing reality. Can we actually make this at a large scale? And can we do it at a reasonable cost? It's a really complex puzzle to solve. Okay, everyone, it's time for a super quick recap. Let's make sure we lock in all these key points so you're absolutely ready for your exams. So pay close attention. These are the really important bits. Just remember these simple points. Solids are your stable and precise workhorses. Liquids are all about rapid action and flexible dosing, and semisolids are for a targeted, localized effect with fewer side effects. And always remember, the final choice of the form depends on that balance between the drug, the body, and the factory. Simple as that. All right, here's a classic exam question for you. A little hot tip for your GPAT prep. Which of these dosage forms gives you the fastest onset of action? Is it A, tablets, B, capsules, C, solutions, or D, ointments? Take a second and think about it.
And the correct answer is C, solutions. Now, why is that? It's simple. With a tablet or a capsule, your body first has to break it down, that's disintegration, and then the drug has to dissolve. But in a solution, the drug is already dissolved. It has skipped those 2 steps and is ready for immediate absorption. This is a fundamental concept, and it comes up in exams all the time.
So, to wrap things up, I want to leave you with a thought. We've talked about the dosage forms of today, but what about tomorrow? What do you think is the next big thing in drug delivery? Will it be nanoparticles? Or maybe 3D printed pills, personalized just for you? Let me know what you think in the comments. Thanks so much for watching, and I'll catch you in the next lecture.